20th October is an event celebrated annually in Kenya. This is a day where we get to celebrate our heroes. But who really is a hero? Shujaa ni nani? Anyone can be a hero. But what impact have you done in the society? What have you done to be celebrated? Today on this MASHUJAA Day, I am proud to have two heroes. Two of my heroes who have transformed the lives of people living with epilepsy in different ways. Well, I have Dr. Vincent Orimba and Vallent Adhiambo. Karibuni sana.
Thank you for having us.
Vallent, how was the childhood experience?
Well, my childhood experience as a young girl with epilepsy was not so easy. It came with so much challenges here and there, because as I was growing, starting from the family level, it was not easy for both parents, my parents, to accept me with the condition. So even when I interacted with the society in school, primary school, it was not also easy, because I was just in class together with other people, other pupils without epilepsy. But then you'll find that sometimes I'm sidelined by the teachers, for example, when it comes to some activities, because I'm epileptic.
So, being that you've said you were in primary school by that time.
Yes.
So when did you discover that you are epileptic?
To me, I discovered when I was in primary. When I was back then, it was not grade, it was class. When I was in class 1.
Class 1.
Yeah. But actually, the actual condition started when I was 1.5 years old.
Oh, but you just came to realize when you were in class 1?
Yes.
So how was life after realizing? Because of course, when you realize something new in your life, it comes with some changes. Maybe you start avoiding some activities, doing this, doing that. Yes.
So after realizing that I had that condition, it was not easy, because I couldn't even understand whatever was happening to me. I could just be told by people, you collapsed, you are convulsing, but I didn't really understand what even the convulsion is. So it was something, what I can really remember about it was the part of being sidelined when it comes to different activities as a pupil. Yes.
I would like to add something about epilepsy. Epilepsy can start at birth, during childhood, during teenage, and even adulthood. You'll find a good number of people who develop epilepsy at 20 years. They say it can't be, because people assume that it has to start. So depending on the type of epilepsy, it can occur at any time in your lifetime.
So does it mean that it is also hereditary at the same time? It is both hereditary and it can also be acquired in one's lifetime?
What is interesting is that the cause of epilepsy are many. There is one that is hereditary, and it's just about 5% of our population, a very small number. But the fact that you have, it's occurring in a family does not mean automatically that all people will have it. There are other factors that may accelerate it, and I'm sure it will come up in our discussion. So,
sure. So, Vallent,
Yes.
So after you discovering that you are epileptic in nature, how did you take it? Because I'm sure it's been many years down the line. When you were in class 1, right now we are in 2024, it has been a long time. How was life afterwards?
So when I was in primary school, I didn't really know much, nor really understand more about this condition. Me, I could just see it. I've had an attack, and then being taken to the hospital. Sometimes I was given the traditional herbs to take. I could just follow instructions, but it was really stigmatizing, because even fellow pupils and even people in the community around me could isolate me. Nobody wants their child to even play with me, because they feel like I could transfer the condition to their children. So you see, that stigma was not so easy. But then when I was in high school, that is when I really experienced the biggest challenge. because I could now start comprehending whatever epilepsy is. And when I was in high school, when I was in Form 2, before I went to high school, it had disappeared for some years, around 7 years. Then it came back when I was in high school, Form 2. So when it came back, it was not so easy. The school, the management, the principal, they could not really understand why, especially most of the times towards exam, I'm having a series of seizures. They were like, you fear exams. Why does it only come when towards exam? So that one was also stressing me because I was feeling like I can't really control what is happening to me. Hata mimi najipata tu towards exams, I have a series of them, you know. So, but then I couldn't understand still. So it was not, that journey was not easy until after high school. I think that is when I started understanding it perfectly well. Yes.
If I may interject, epilepsy is a very interesting disease in that there are what we call triggers. If I have epilepsy, a trigger will make me have an attack. A good example Val has given, tension can precipitate attack. And that's a misunderstanding most parents have. Like that blame game that she's fearing exams was wrong. The understanding of epilepsy is that, for example, if you are hungry, your blood sugar goes down, that is a trigger and you'll have an attack, even if you are on medication. There are other triggers, and one the important thing message is every patient with epilepsy should know their triggers, and you work with your doctor to know your triggers so that you minimize them, and that way you live much better life.
So Vallent just mentioned that there is a time it disappeared for like 7 years. Maybe you can just tell us what, if you might know, what made it disappear, or you also just found yourself it's not there.
Oh no, if I can remember well, I used to go to, I was taken to a man in the village who gave me some herbs to drink. So I used to drink the herbs, and for a period of 7 years, the condition disappeared. So when I went to high school, that is when it came back again. Yeah, so I tend to believe that it's because of the herbs that I was drinking that it disappeared. Yeah.
Epilepsy responds to medication. What is happening about epilepsy also is that some of it just disappear. 50% of cases we see of epilepsy, we do not know the case, and 50% of them will just disappear with or without treatment. So what is important is first identify which type it is, identify the most relevant medication that could be used, and sometimes it can go into what we call a remission, and you stay for a period without it. And some patients, it just disappears completely. We have adults now who used to have epilepsy when they were young, but it's no longer there. And we have not got to know why, but it does happen. What is important is that when you know you have epilepsy, you should go for the right treatment, take your medications as instructed by the doctor, and manage those triggers. For instance, the trigger she had with the exams is quite expected, and that's why the Ministry of Education actually would like that children who have epilepsy or people who are going to do exams should be registered, because during exams they get the attacks. In fact, most times you find people with epilepsy, their performance in school is affected, so they don't get the right grades, not because they are not sharp, they are, but because the triggers are more, and therefore they will not study more, they will not do the exams in their normal self.
So how does a person know that he or she is epileptic? Like, how would I know that, apart from the things that, for example, Vallent said, she was being told that this and this happened, you maybe fell down, this and this happened. Is there any other way that a person can know that he or she is suffering from epilepsy?
That's a good question. Epilepsy, although we are giving it one name, it is very many different types. Now, it depends on the type you have. We have a type, which we call absence seizures. I'm having it and I just go blank. You just see me staring or doing something funny, and then in a few seconds I'm back and you ask me what's wrong, I tell you nothing. And I've had an attack. The absence seizures particularly, I would like to emphasize, is very, very important to realize it. Particularly, it happens in early childhood. Many times when you have it, it will be ignored and then it will develop into the generalized tonic seizures, the one that somebody falls down. That's one. But for you to know you are epileptic, there are two scenarios. There's partial seizures, the one that comes, you are aware, you can even feel it coming, but then you do not completely lose consciousness. And then there's the generalized one, where the whole brain is involved, you completely go unconscious. Immediately after an attack, you ask me what happened, I tell you, I don't know. And some people misunderstand that. You have seen me falling and, kicking, and then you ask me, what happened, and I tell you, I don't know. You not understand that. So it depends on which type you have, and what usually happens is the partial one, the one that comes that you are aware it's coming. You can even see your hand shaking, but there's nothing you can do about it. And then there's the one that you completely lose awareness, and you're completely unaware. And when you wake up, you are confused, you are tired, and you even sometimes have memory lapse. You can't remember anything. So usually it depends if you want to know if you have it or not. That is why it's very important. If you have an epileptic person with epilepsy, the observer, the person who witnesses it, is very crucial for me as a doctor to identify which type, because you will be seeing. But you see, in our normal society, if I start having seizures, the tendency is people have to run away fast. And by the time you come back to me, I'm gone. I'm already awake.
Yes, you're
so
back to
it's
your normal
very important to go near a person who has epilepsy, because at that time there are things you can do that will save their lives, because that attack can actually cause them death. So being aware of what it is and the immediate response of people around are very important. So what I would say is that if you have epilepsy, one is that you can be aware of it or you may not be aware of it.
In simple terms, can you explain how epilepsy affects the brain that now makes the whole body to stop functioning all of a sudden? Yes.
Epilepsy is a neurological disease. In the human body, we have various systems. There is digestive system, the one that receives food. There is the respiratory system, the one that takes oxygen. Now, one of the major systems that control these other many systems is the neurological system. And the neurological system, the center is in the brain. It's the brain that coordinates all your activity as a human being. What you see, what you smell, what you taste, what you hear, what you touch, and even how you move. Now, if a disease like epilepsy, the coordination of the body is done through electrical waves. The brain cells generate electricity, and that electricity moves from one nerve cell to another and ends up controlling your body. Now, with epilepsy, there is an abnormal high generation of electricity that sets everything into, disorganizes everything. So you'll find somebody with epilepsy can be seeing things that are not there, can be hearing things that are not there, can be smelling things that are not there, can be tasting things that are not there because of that abnormality. In fact, I would like to explain that better. People with epilepsy have a lot of salivation coming. There is a normal way your brain is controlling the saliva in your mouth. When you put food there, the brain says there's food. The taps that produce saliva are opened. Now, in epilepsy, the taps are opened too much, so there is excess, and that's why they salivate. Similarly, people with epilepsy pass urine, or sometimes even they pass stool. What is happening? The valves that control urine, when the bladder is full, a message is sent to the brain, and the brain is asked, open the taps so that you go and pass the urine. But with epilepsy, the taps open because there's an abnormal upsurge of electricity. So some of the symptoms you see, you'll find, for example, if somebody is having a seizure, they will start staring at a place. When they are staring, they are seeing something you are not seeing. It's not there, but they're seeing it. So the brain is confused. So usually, the symptoms of epilepsy affect your whole body. That is why most times we see the movement, the kicking, but that is just a small part. So the symptoms are varied and it depends on which type of epilepsy you have. But generally, the brain is the central nervous system. It's part of the system of the body that controls all the other parts, which means if you have epilepsy, all your systems can be involved. So usually, I would want as a doctor to talk to the person who saw. And my problem is, most time people run away fast, and you're supposed to be observing what is happening. So if you have anybody with epilepsy near you, one, you have to be near them.
What are the different types of epilepsy that are there?
Generally, we can classify epilepsy into 4 types. There is the focal epilepsy, where it could only involve the hand. That is localized. And what we mean by focal is that the brain, as an organ, has various parts. If the abnormal electricity is generated from one part, and only that part, then we call it focal. So you'll find, for example, the back of the brain controls sight. So somebody with epilepsy that's emanating from the back of the head, you'll find they have a problem with vision. They'll start seeing things. Somebody with epilepsy in another part of the brain that controls, for example, breathing, you'll find their breathing goes higher. So usually, epilepsies, we can divide them into 4. There is the focal ones that starts from an area of the brain. And then the electricity is generated, and then it comes down and somebody settles. The second one is actually a generalized seizure or a generalized epilepsy, whereby the whole brain is involved. So I'm sitting and suddenly I just go down and I'm, convulsing. Then there is another one that it starts locally, a focal, but then it spreads to the other parts of the brain. And then finally, usually, there are some that just are spontaneous. We even don't know why they occur and how they occur. Now, basically, what one needs to understand about epilepsy is that it's not one disease. 2, there are various types, and it's also with the whole help of an observer, somebody who observes, and with the doctor asking you the right questions, you'll know which type. And then thirdly, all of them, there are drugs that can be able to control them. And that, for me, is the important message.
So you just mentioned drugs. So is epilepsy treatable, like fully treatable, or it makes one to be on drugs throughout their lifetime?
I would like to clarify that. In medicine, or in the lay term, when I tell you I have a disease, the next thing you want to know is there medicine for it or not? What's happening about epilepsy treatment, which is not understood by many, is that it's a preventive care. Preventive health care is whereby you give a child a vaccine for measles, then they won't get measles. In epilepsy, you take these drugs and they block that electricity. If you don't take your drug, the level of drug goes down, you'll get your attack. So it's a preventive kind of care. Treatment for epilepsy, these drugs control those seizures by blocking that abnormal electricity. And that means if you don't take your drugs, the electricity will pass and you'll get the attacks. So in terms of managing epilepsy, these drugs only block the seizures. They do not treat. In fact, the only area you can talk about epilepsy, and it's a very small portion of epileptics, is where you do some surgery in the brain and remove that part. But for majority of cases, the drugs block the electricity. And that means you have to take your drugs throughout, continuously and regularly. Most of our patients who have actually suffering epilepsy, usually they do not understand this. And therefore, you'll find cases where somebody misses to take his drugs, or somebody decides these drugs are very expensive, let me take one today and skip, then the drug level goes down and they get the attacks. In fact, majority of our patients suffer, apart from the triggers I mentioned earlier, they suffer from not understanding that you have to be consistent. If you have to have that barrier, it has to be there continuously, and it's only by taking your drugs at regular times. This is morning, same time 7 a.m., same time 7 a.m., depending on what your doctor has told you to take. If we explain to them to adhere and take the right dose, the right time, usually epilepsy can be managed very well, and you have somebody leading their normal lives.
So, Vallent, if I can ask, when and what inspired you to start the Geno Foundation?
As a person with epilepsy, I've gone through so much challenges, especially at workplace. So I've been working in different spaces, and it is not easy for you to get a job based on the fact that you are epileptic. But once in a while, when I have attacks at my workplaces, the employers won't be comfortable, and so they just dismiss me. So I went through that severally, but the last one that I went through that made me feel the urge to do something different in the society. I was working somewhere, and then I had worked there for 2 years, and I had even disclosed that I'm epileptic. So during COVID, when COVID just started, they were laying off people. So I was among the 4 people that were laid off, and among the 4 people, we were 2 people with epilepsy. We were laid off. So I couldn't understand, but some of my colleagues disclosed to me and told me the real reason why you are being laid off is because you are epileptic. So when I heard that, it really hurt me. I felt hurt. I really felt like, no, there's so much that we need to do to the community to support people like me, to make this condition visible to people in the society. So that is when because I had started seeing Dr. Orimba, that is when I shared with him my vision. I told him I want to go to the community and start creating epilepsy awareness based on my own experience and journey as a person with epilepsy. So that is back in 2020, and that is when that is what drove me to do that, whatever I'm doing today in Geno.
I would like to add that discrimination is one of the challenges people with epilepsy have. Right from childhood, you'd find a child who is epileptic is treated differently, even within the household. When they go to school, even in the society, a person with epilepsy is kind of branded, stigmatized. One of the things I would like to emphasize is that epilepsy is not infectious. If you have epilepsy, whatever we do together with you, I can never give it to you. We discriminate these people, and I'll tell you that majority of people with epilepsy, even their level of IQ is higher. They are much better. If you take a cohort of people who were born on the same day with Val, you'll find that she'll be top of her class if she's given the right support. It's very important for our society to really accept this condition. It's one of the oldest diseases in the world, in man. But there's so much information that we have not used to help us.
Ever since you started the organization, how has the Geno Foundation has been helping people with this epilepsy? Like, what does it do to people? What does it offer? Or what impact do you have to people with the epilepsy?
Geno Epilepsy Center for Empowerment is an organization, a CBO, community-based organization, that was founded in the year 2020. But then it was officially registered in the year 2021. The organization was founded by me, and the main reason why I founded the organization was the experience that I had previously as a person with epilepsy. And so I felt like the main agenda was to create epilepsy awareness based on my own experience, because I'm not a medic. And I started by creating awareness in schools and in churches. And I started with the community where I'm coming from. So after that, we created awareness for some time. But then the clients that I was meeting were like, okay, you've taught us well about epilepsy, but now what next? That is not a permanent solution. What are we going to do, or what are you going to do to us so that this condition can be managed or healed? So I went back to my doctor and spoke to him and asked him, what do I do? What do I tell these people? At first, it was not so easy for me because I didn't have the funds, I didn't have the I didn't even have the idea. So the doctor told me, because he was also attending to patients in a clinic around within Kindu Bay. So the doctor told me, you just go on with creating the awareness. Then in case anyone feels like he should be seeing the doctor, refer them to me. And that is how I started doing that. So I was creating awareness and referring them to the clinic where the doctor was working by that time. So with time, it just went. Then the same clients started pushing me again in telling me, now Kindu Bay is very far from where we are coming from. Majority of us are coming from. Why can't you just talk to the doctor and bring us a clinic within our area so that it can give us easy time? I didn't have any idea. I was blank. I went back to my doctor again. And that is when we started the monthly epilepsy clinic. But with time, I found myself now running the monthly epilepsy clinic. Also, during the monthly epilepsy clinic, my clients could come. One girl once came with a dress she had made using just a needle and a thread. Anashona, anakata, anashona vizuri, nguo ya doli. And then she says, and get 30 bob, 50 bob. So you see, through that, I noticed that, so people with epilepsy, however much most of us have not even gone to school well because of the discrimination and stigmatization we get at school, so there's something else we can do to even generate income. And that is how I introduced another project, which was initially was not even in my mind. I introduced the Talanta Yangu project. So as time goes by, the Talanta Yangu project was just focusing on things to do with the handwork, knitting, drawing, and such kind of things. But then later on, I met some group of clients also who are telling us, we are not talented in this knitting and whatever that you people are doing. We are talented in agriculture. So we introduced another project, which initially was not even in my plan. I didn't even see it coming. We introduced the Talent and Agribusiness project. So as days go by, I realized that there is need. Not epilepsy management is just not about awareness and taking the medication. It is more than that. Yes.
Just to add a little, there is a huge treatment gap of epilepsy in the world, in Kenya. The treatment gap, the number of patients with epilepsy who are getting drugs, correct drugs, is so high, is above 80%. People go to hospitals, they are started on treatment, but then you find if you don't meet an expert in epilepsy, they will just, it's easy, you can just Google and say epilepsy, which are the drugs, and you give. But it's very critical. You have to see the right person. Like in her experience, until the time she left her job, she was on medication. But then when she came to me, I realized that the medication was not being given in the appropriate dose or the correct drug and the rest. And when I started her on that, she'll attest to this, she realized she can be seizure-free.
Dr. Orimba, what has motivated you to offer this service to the people with epilepsy, and especially to work with the Geno Foundation to help these people?
In life, one has to commit themselves to one thing or the other. When I first got exposed to epilepsy care, and that is way back in 1985 in Kenyatta Hospital, neurology clinic there, I realized that epilepsy is a very unique condition. And as I interacted with the patients and as I saw them, I realized that epilepsy is not just the drugs, the medicines. There's more to it. And for a successful care of somebody with epilepsy, which is a chronic disease, a disease that you live with, you need to have that backup. You need to first explain to the patient to know what really it is and get them commit themselves to the treatment. But having gone into the medicine world for over 40 years, I realized there are very many chronic diseases that exist. And I realized that, interestingly, it is the oldest disease known to man. And here is a situation where even Kenyans who have gone to school, who are learned, are still illiterate about it. So there's a big gap in information. And therefore, committing into an area that has a gap, you'll find you get fulfillment. So it's all about being totally involved and realizing that in the society, you can't do everything. But if you take one, can you do it well so that at least you impact on the few that you want? Because you make a lot of difference. Like now, she'll tell you, in our clinic in Geno, we have young girls and boys who have now managed to even finish their high school. Some have even gone to college. And they would not have gone if it was not that dedication, that support that we are providing. So sometimes in life you have to take your direction. And for me, it's very fulfilling to have somebody like Val who had had all that experience from childhood up to now, and she's still there, and she's also committed. So it's also, and one interesting thing about Geno is that all of us are volunteers. We are all doing it voluntarily because we feel that's the price we should pay this. You know, God will pay us, but we make a difference in people's lives. And that's the motivation about Geno. We are all volunteers.
So what does Geno offer to these people, apart from maybe you've just mentioned that there are some who have gone to high school, maybe without joining the Geno Foundation, they couldn't have gone because of the stigma and the sidelining of those people with the disease in the society. So what does Geno offer to these people, and how do they benefit from the organization?
Generally, apart from just the medical part of it, we offer empowerment. Empowerment, number one, is this advocacy that we do in schools. We work in different schools where our clients are and where we don't have clients yet, but we create awareness there, both to the teachers and to the pupils and students. We teach them more about epilepsy. Then we also identify, for example, we have a client whom we identified in 2021, and she passed her exams well, but then the family couldn't afford the high school fee. So through Geno, we got to our partners, the National Council for Persons with Disability, and through that, we managed to get him a full scholarship to high school. She's sitting for her final exam this year.
Wow.
So you see, that is empowerment bit of it. We also empower them in different, using the scales in the Adhiambo projects that I mentioned earlier. So we identify so and so is skilled and talented in this. So we empower them there. If we can get, for example, right now there's a group that has been empowered by our partners, Ajira Kenya, on ICT issues, and they've been offered paid internships. They are being paid 25K per month internship after that short training. So you see, that is empowerment also. Yeah. So it depends. It depends with where somebody is talented and skilled. So we pick on that, we identify, and then we collaborate with other partners to support them.
And maybe in terms of support, does a person have to maybe be an epileptic person, or he or she can just volunteer to offer support?
We have many volunteers who are not having epilepsy in our organization. But currently we are really advocating for persons with epilepsy to also join the team and even volunteer in doing different things. Because through that, they get empowered. And that one can help them in one way or the other.
So what are some of the challenges that we've encountered so far ever since we started this foundation?
One of the major challenges is the financial part of it. It has not been easy since all of us, we work on a voluntary basis. So acquiring things like the medication has not been easy for us, because in our clinic we have different people. There are some people who can't even afford. They even walk long distance to come for medication. So mtu akishatembea kwa hiyo jua yote na hiyo ni trigger already. akakuja, then unamkataza eti hawezi ona daktari eti hana pesa. So what am I doing to the community? And then the anti-epileptic medication are very scarce and expensive if available. And then the community still bado hawataki kuamini that epilepsy is manageable, especially our fathers and our men. They don't want to believe in that. You find even in our clinic, watoto wanaletwa clinic na mothers. Where are our fathers? They still have that belief that mtoto akiwa na shida, akiwa na ugonjwa kama huu, it's because ametoka kwa kina mama yake ama mama yake ndiye ameleta. You see, we would like also to see our fathers, our brothers accompanying us to the clinics also. Yeah.
So far, it has been good having you guys, because I'm very glad and I'm very proud of you starting the Geno Foundation, and in the Geno again you start the Talent Yangu. I think it's an incredibly good work and I can congratulate you. It's a good thing you guys are doing. So how many beneficiaries are there in Geno, and if a person is interested, how can he or she contact the Geno Foundation?
At the moment, we really getting statistics of beneficiaries is not so easy, because you'll find that today I come to the clinic for maybe 3 consecutive months, and then when I feel I'm getting better, I stop coming. That is what is happening, another challenge that we are experiencing. But roughly, our clinic right now is running from about 50 to 70 clients. Yes. That is the people that we are touching so far in our monthly epilepsy clinic. That one we've not included the outreaches that we are doing in maybe public spaces. We do a free medical camp there. That one is not included. That one. This is just a statistics of the number of people that we've touched who are coming to the clinic for our services.
If I may add, we have a problem with data in epilepsy work, and that's partly the reason why not many people are doing it, because we don't have the data. Now, there's the tendency to say the government should generate the data. The point here is every member of this society is supposed to come up. If you know your neighbor has a child with epilepsy, if you know your friend has epilepsy, them coming forward is when we'll get the correct statistics. And there is a big gap in data on epilepsy. If you go to any hospital and you ask the numbers, they will not give you good numbers. So for us, our data will be built up by the community. And that's one of the areas that Geno is looking forward to. We work with our local hospital, like in Rongo, the hospital, and we're trying to see how we can generate this data so that it's used for decision making, for planning. But I would like to also say the government is making the effort. The National Council for People with Disability is registering people with epilepsy, because a lot of people have got surprised when you tell them epilepsy is a disability. And these are the things we are trying to bring up. You start in a small way, a long journey, start with the first step. And for us in Geno, that's what we believe.
Okay, for anyone who may be having any inquiries or would like to reach us, you can go to our Facebook page, Geno Epilepsy Center for Empowerment, or even our website, Geno Epilepsy Center. You'll get our contacts there, and you'll get more information about the condition there.
Well, before you continue, let's hear from the beneficiaries of the Geno Epilepsy Center for Empowerment.
I'm Sally Nakinyo Kendo from Homa Bay County, a caregiver to Asha Okendo. I'm a mother to her. Asha started collapsing at the age of 7 years, as early as that. And by then, we were not aware of this disease called epilepsy. We moved all around looking for the drugs, these herbals. We went all around using a lot of money treating her, but all went in vain. By this time is when we met the family of Geno, being led by Madam Val. We were taught about this disease of epilepsy. Madam Val talked to us Dr. Orimba talked to us. Geno, as a family, has made us. Asha got the scholarship from the Kenya Pipeline. Thank you, the family of Geno. Continue helping people all around the world so that another person, another life can be saved like mine. Thank you very much, the family of Geno. On this MASHUJAA Day, you are the shujaa.
My name is Elizabeth Adhiambo. I am a person with epilepsy. Today is a MASHUJAA Day, and I have someone very special I would like to celebrate, and that is Vallent Adhiambo, together with the organization that she's running, that is the Geno Epilepsy Center for Empowerment. As a patient suffering from epilepsy, I would say I have really benefited a lot through this organization. This is a condition that I've experienced all the way from the age of 3 until now that I am 26 years old. I cannot say that I'm the same way I am right now as I was some years back before I joined Geno Epilepsy Center for Empowerment. Val has really given me that platform where I am also able to express myself, not just as a patient, but also a caregiver. Through the organization and through partnership with other organizations, I have been able to find platforms which initially I never thought I would find myself in. And that is a very clear indication to people that despite someone having this condition, it does not define this person, neither does it deny this person the opportunity to venture in that which you're so passionate about. I will not also forget to celebrate our very own Dr. Vincent Orimba. I will say among all the medical practitioners that I have encountered all through my journey having epilepsy, Dr. Orimba seems to be so different from the rest. And one of the things I would really love to celebrate about Dr. Orimba is his patience. He is very patient with his patients, and he is also very persuasive. On the other hand, I love the aspect of him doing follow-ups on his patients, on how they are faring, how they are going on, and how they are trying to manage on themselves so that their health condition may improve and get better. But through the clinics that we do have and through the conversations that I always have with him, I will say that he has also made so much impact in my life. And even as we are working as a team with the same aim, with the same mindset of bringing impact to the lives of people living with epilepsy, I would say that Dr. Orimba, he has really made impact in the lives of so many people. Geno, you are my shujaa.
Wow, that's so powerful. So finally, to finish or to wind up this show, how or what would you like to tell people in the society, people who are living with epilepsy?
Epilepsy is just a condition like any other. It is manageable. You can live with it. You can do your thing so long as you see the right doctor, you follow the right prescription, and you manage and you focus on the triggers. You are able to identify your triggers.
As my final input into this special day, MASHUJAA Day, everybody has a role to play in our society. And epilepsy, interestingly, the drugs are there, the medicine is there, but that ability to come forward, can we have the whole society coming up and saying, look, epilepsy is not mashetani, because there's a tendency. The traditional medicines we use are not working. We have in our society very prominent people who have epilepsy, but they are keeping quiet about it. I would like to hear from them because they will help us. There is a gap in treatment. Efforts are being made, But let people come up first. For me, that would be the last message I would like to give in terms of let us encourage people to come forward.
Indeed, anyone can be a Shujaa. Those were my two heroes, Dr. Vincent Orimba and Vallent Adhiambo, who are also the founder members of the Geno Foundation that helps people with disabilities. Thank you very much, my heroes. Thank you for the good work you're doing in the society. Thank you for empowering the less fortunate. It's incredibly a good work, and I am wishing you people the best. And thank you for creating time and coming here. And those were my Shujaas. Indeed, they are doing something very good.